In regards to the follow-up on the scapular limited mobility and or rationale for why someone may have the premature elevation of the scapula, as I mentioned, first and foremost comes the modification of pain and range of motion. So if we focus in on the algorithm that we have in front of us, so it would be pain and range of motion, pain with muscle guarding. You would want to do some diaphragmatic breathing, table slides, shoulder pendulums, things to relax the shoulder. We at length talked about the glenohumeral limitations, where you could have either shoulder instability or actual limitations in the mobility. Those would be triaged differently by the rest of this algorithm. But where we want to hone in here is on the limited scapular mobility. So, with limited scapular mobility, the two predominant motions that you want to be promoting are going to be limited posterior tipping and limited upper rotation. You want to be promoting posterior tipping. You want to be addressing the limitations that in both of those specifically. And so phase one exercises would include both, or interventions would include exercises, but also manual therapy. So pec minor, soft tissue mobilization, pec minor pin and stretch, scapular mobilizations, promoting posterior tipping, with the exercises, seated scapular retractions, prone posterior tipping exercises that also promote that type of retracted position or reinforce that, but with an emphasis on the tipping aspect of it rather than just pure retraction. And then the split stance high to low row scapular row, which would be with a straightened elbow, to try and promote that same kind of posterior tipping aspect. You can think of it as a reverse of a scapular punch. Upper rotation, you're going to be working on your upper trap and STM, and then your rhomboid stretch, all along with scapular mobilization of upper rotation. And then the supine serratus punch, quadratus serratus activation exercises, and plantigrade scapular push-ups would also be indicated. Moving on to your second phase, which would be muscle activation and motor coordination. This is where you would get into the scapular positioning exercises that were a little bit less manual based, right? So posterior tipping, this would be your progression in prone for that sequence. And then your upward rotation, you have open kinetic chain progressions and closed kinetic chain progressions exercises. But yeah, that would be the follow up. And then to how you may what the current sequence is for addressing scapular limitations that may contribute to the altered scapular mechanics as someone lifts their arm up overhead.